Hello, Mr. Jones. My name is Morgan. I'm going to be your nurse today. Today I'm just going to be cleaning and changing your wound dressing. Is that okay? Okay, are you in any pain? Because if so, I would like to give you your pain medication before we get started. But if not, I'm going to go ahead and assess your wound and check the drainage, okay? Can I please have your name and date of birth? Good, thank you. Okay, so I'm just going to check your wound now to see how it's healing, to see if there's any excessive drainage, abnormal color. Does it hurt when I touch on the sides right here? I'm trying to see how tender it is. Okay, so there's no abnormal color around the wound, no excessive drainage outside of the bandage, and upon palpation, light palpation, it is not tender, so it's good. So now I am going to pull this tape off, okay? Let me know if it hurts. I'm gonna pull in a way so that the patient does not see the wound. And I am ensuring that the hair is not being affected by it. Okay, so now I'm looking at the drainage amount inside of the wound bandage and assessing for color, odor as well, and what type of drainage. So now I'm just going to fold this and throw it in a biohazard bag. And I'm going to unpack the wound, throw this in a biohazard bag. The drainage on that looks regular, normal. Now I'm just checking the wound before I cleanse it to see if there are any deeper indentations. Again, checking the drainage, the color, the odor, seeing how good it's healing up. Okay, so no abnormal changes there. So now we're going to proceed to cleaning our wound. So I'm going to change my gloves. Okay, my gloves are changed. So I'm just going to check my dressing package before I open it. Make sure it's not torn or anything. It is not expired. It has everything in here that I need, except for my tweezers. My tweezers are sterile. They are not open yet. I also have a pack of sterile Q-tips if needed. I have my gloves. These are okay, not open, not expired. And I have a gauze and my ABD pad. So I'm just trying to position my patient. Got my gloves right there. I'm actually gonna move this until. Okay. So now I'm gonna open my package and I'm gonna open it away from me. Okay, great. So we have our package open. Now I'm going to tip it over so that my contents can, well, first I'm gonna grab my layer, my protective sterile layer. And I'm gonna move this out of the way just a little bit until I'm ready. Grab my barrier. And I'm going to place it with the shiny side down. That's going to be that blue side. Okay, so we have our sterile filled. I'm just moving my patient. Okay. So we are sterile over here. We are sterile. We are sterile. Yep, we are sterile. So, next I am going to pick up my tray. Tray is picked up. Now I'm just going to flip this over. Okay, everything is in. And I'm going to set up my sterile gloves here because I do not want to contaminate that. So I just bring an extra pair of gloves so that just in case it's hard for me to reach. It's hard for me to reach the gloves in the pack. I'll have a set already set aside. So now I'm just going to get a sterile fill for my gloves so I can put those on. Being sure to only touch the 1 inch diameter. One inch diameter. And I want to do this so you can see it. I'm not hanging over my sterile fill that I just set up for the dressing change. So we have gloves open. Okay, now I'm going to take my non-dominant hand to slip on that glove. I'm going to cuff. Cuff this glove so that I'm able to put my left hand in. Okay. That is on. So we are remaining sterile by doing this. I'm going to go ahead and take my saline to clean. I'm going to go ahead and pour that in. Trying to place it to where you guys can see. Okay, the solution has been poured in there. Okay, opening my sterile tweezers, dropping that on there. So now that we have our tweezers, we are going to go ahead and start cleaning the dressing. And I'm going to clean from the inside to the outside. Throwing it into the bin. cleaning from inside to outside, inside to outside, making sure that the tweezers aren't touching the patient's skin. I'm gonna do one more cleaning. Inside to outside, inside to outside. Okay, now we're going to pack our wound. Draining any excess. And I'm going to use my Q-tip to help me pack it. And this looks like it's going to fit just perfectly. And I'm making sure the Q-tip or the tweezers aren't touching any skin surfaces of the wound. Now our wound is packed. There aren't any spaces showing in our wound. Put that in a biohazard bag. Okay, now I'm going to take a gauze pad. I'm going to put that gauze pad right there on top of that. And next I'm going to take my ABD pad. Make sure the blue side is facing up. I'm going to place that right there. Sorry guys, you can't see. Have my tape. Okay, Mr. Jones, now I'm just taping your wound bandage up nice and securely. Make sure it stays clean. How is your pain level, Mr. Jones, since I've been cleaning it? Are you okay? Okay, good. Okay, so we're just gonna do a few more pieces of tape. Make sure that this is staying down. I'm gonna do one across. Yep, this is gonna be closed up real nice for you. Okay, we're almost done, Mr. Jones. I just have to label. We just have to label.